Good morning. In 1865, barely 6 months after the end of the Civil War, and just 2 years after the Emancipation Proclamation, three men established the Fisk School in Nashville. The school was named in honor of General Clinton Fisk of the Tennessee Freedmen's Bureau, who provided the new institution with facilities in former Union Army barracks near the present site of Nashville's Union Station. In these facilities, Fisk convened its first class on January 9th, 1866. The first students ranged in age from 7 to 70, but shared common experiences of slavery and poverty and an extraordinary thirst for learning. Behind me, behind this image here, is a mural of the famous Fisk Jubilee singers who traveled the world to raise money for what is now Fisk University. And today we're in Jubilee Hall. We're excited to be at Fisk and to be with you. I'm Al Richmond, Executive Director of Community Campus Partnerships for Health. We're a national organization that builds partnerships between academic institutions and the community. I'm a proud alum of Livingstone College, a historically Black college in Salisbury, North Carolina. Welcome to the fourth session of the All of Us HBCU Road Tour. Our journey started at Howard University. We went on to Tuskegee, then to Morehouse School of Medicine, and now at Fisk University. Next slide, please. So our agenda for today, for those of you who are joining us in person and live, is we will have an overview of the Researcher Academy. You'll hear more about this NIH initiative. You will hear presentations from students at Fisk University and also a presentation from our colleague at Meharry Medical College. We then will have Q&A. We'll have remarks from Dr. Kareem Watson, who is the Chief Engagement Officer with the All of Us program. You'll hear more about the Researcher Workbench, and then we'll celebrate our institutional champions. I want to thank all of those at Fisk University who have supported us and helped us make this possible today. Thank you very much, and we appreciate your support and your help. Next slide. I want to acknowledge the team and the work of Community Campus Partnerships for Health and the team that has made this possible today as well. We're joined in person with Dr. Paul Kuttner, who is our Director of Partnerships, and Angela Franklin, who is an engagement lead with the All of Us project. Again, Community Campus Partnerships for Health is a national organization that builds partnerships to address issues around health equity and health justice. Next slide. I also want to introduce the RTI team who are joining us as well today. You'll hear from one of them as part of today's convening. So we welcome you on behalf of Community Campus Partnerships for Health, Fisk University, and RTI. I'll now turn it over into the hands of my colleague, Dr. Sula Hood. Dr. Hood is a senior research scientist with RTI International and a co-lead for the All of Us Researcher Academy. Dr. Hood.
Hello, thank you so much for the warm welcome, Al. So today I'll be talking about the Researcher Academy and providing an overview. Next slide, please. Okay, so I just want to start out for an overview and description of the All of Us research program for individuals who may not be familiar with it. The All of Us program is a historic effort to study data from 1 million or more people across the United States. There's intentionality around engaging people from diverse populations to inform precision medicine. So now I'll talk a little bit about how the All of Us Researcher Academy plays a role. This academy is very important because it connects researchers to the All of Us Researcher Workbench that houses the All of Us data. Next slide, please. Okay, so the All of Us Researcher Academy in particular is very intentional about engaging researchers from diverse populations and connecting them to the Researcher Workbench. Next slide. So I want to talk about a few of the components that we have as a part of the All of Us Researcher Academy. We offer a large and growing suite of tuition-free short courses. These short courses help researchers to prepare to work with the data in the Researcher Workbench, as well as write up manuscripts, write up grants that utilize the data. And so we have a large range of courses ranging from how to analyze the data, research dissemination, all the way even from things related to self-care as researchers. Next slide. Another component of our Researcher Academy is the Institutional Champion Awards. And these are funding mechanisms which support teams of researchers to conduct research with the Researcher Workbench. These teams are comprised of faculty members, postdocs, as well as students. And we're intentional about funding teams that are interdisciplinary in nature, because the Researcher Workbench in itself has variables focused on a wide range of topics. To date, we funded 3 groups of institutional champion awardees across 18 institutions. Next slide. We also have an internship program that is a part of our Researcher Academy. And these internships are created to really facilitate an experiential learning opportunity for students to work with mentors that have active projects in the Researcher Workbench. The internship is 4 months in length and can be conducted virtually or in person. And at the conclusion of the internship, students are expected to submit an abstract for inclusion at a future All of Us Researchers convention. We had our first internship cohort last summer in 2023, and we are currently accepting applications for individuals who are interested in being interns, as well as those who are interested in serving as mentors for our second cohort. During our announcements, I'll share more information about how people can apply to be an intern or a mentor. Next slide. Okay. So I also just want to share about our All of Us Researcher Academy newsletter. We have a newsletter that we distribute on a quarterly basis. We have a strong and growing subscriber base of over 500 subscribers. And this newsletter has multiple sections with very important information. We have a researcher spotlight section where we like to be able to highlight and put a spotlight on the research that students that are a part of the internship or individuals that are a part of the institutional champions are doing. We also have a career corner space to provide career advancement information. We also share out information about announcements for the Academy, including information about upcoming courses and events for our All of Us Researcher Academy, as well as announcements about events that our partners and colleagues are hosting. Our winter issue is now available, and we have the QR code here on the page. Please feel free to scan that QR code and access our various different issues. And we do encourage individuals to sign up for our newsletter. Thank you.
Thank you, Dr. Hood. We will now have presentations from 2 students at Fisk University. Our first presentation is from Arola Mashane. He is an undergraduate researcher studying biochemistry and data science at Fisk and a Stanford University Innovative Fellow. Regina Paul is an undergraduate researcher studying physics and computer science. He's co-founder of a nonprofit organization focused on mental health. They will be presenting on their research using the All of Us Researcher Workbench to explore potential links between sleep quality and socioeconomic status.
Good morning, everyone. I'm Oroluwa Oshane. I'm a junior here at Fisk University, double major in biochemistry and data science. And with me here today is
Regina Paul, and I'm a double majoring junior, majoring in physics and computer science at Fisk University.
Yes, and today we're going to be talking about a case study analysis on sleep quality and deprivation index. Can we go to the next slide? Right, next slide. Okay, so for a brief intro to this research study, the basically to start with a baseline, sleep health is has been a kind of public health issue in past decades, and the idea to this is because quality sleep is very important for our daily physiological and psychological processes. I think everyone can bear, in fact, like agree with me on the fact that how you sleep, how you get to wake up, what side of the bed you wake up in the morning can determine how your day goes for the rest of the day. That kind of happened to me today. I didn't like the rain. And in past, despite the importance of sleep health, we've come to see that millions of people actually suffer from the negative consequences that come from sleep disturbances. And this range from things that might be considered minute, such as anxiety and depression, to diseases that are very fatal, such as cardiovascular diseases and diabetes. And we've seen that recent studies suggest that socioeconomic factors such as like education, employment, income levels, these factors that impact access to resources in communities, they influence these sleep disparities. And so in this case study, we were looking to explore the link between sleep quality and socioeconomic status using predetermined deprivation indexes for areas. And by looking at this connection, we're open to see if we can actually elucidate the systemic factors that influence sleep health in different communities. Next slide, please. Okay, so in approaching this study, the first thing we looked at was a literature review of past papers that have worked on topics related to this, be it sleep health or socioeconomic factors or how they correlate. And then after this, we made use of the data sets that we had on the All of Us research database, and we used that to set a sample size for our study. And then after that, we went through data cleansing methods using the Workbench, Jupyter Notebook, and Python programming language. And then after this, we made deductions, inferences, and steps for future work. Next slide, please. Yes, so in our literature review, we reviewed over 30 papers related to sleep health and socioeconomic factors. And what we found out was that for most of the papers, there wasn't an established baseline as regards how sleep quality relates to income levels specifically. By this, I mean the fact that while some papers indicated that in some instances, high income levels could actually infer very good sleep health, in some other cases, high income levels could also infer poor sleep health. And so there are other factors to be considered when looking at sleep health and probably socioeconomic factors. Another thing we realized here was the science of sleep. And I'm just going to do a brief overview. In the science of sleep, we have the sleep cycle, and there are 4 stages. It's known as the light. It goes from light sleep to deep, to deeper, and to the rapid eye movement stage. That's known as the REM sleep. Now, in all these stages, just a brief example, a brief explanation of the importance of these stages. In the light sleep, basically, light sleep is just the transition from being awake to asleep. When it's just like when you go to lie in bed and then you can hear the sounds around you, you can hear movement, you can hear voices. If somebody is playing something on the TV, you can hear that, but you are trying to get asleep. That's just the region of light sleep. Deep sleep is actually when you are not particularly conscious of your environment, but your muscles are actually active. And so your bodily movement works. You can still move your body and contract and relax muscles. By deeper sleep, you are not aware of your environment. The muscles are fully relaxed. The body tissues get to grow. And deeper sleep is also known as the stage of restorative sleep because that's when you're not conscious. The immune system begins to get strengthened. That's where actual relaxation occurs. And while the REM sleep is just Just to summarize, it is the stage where the person begins to dream. The defining factor of the REM sleep is that the eyeball begins to move. And then just to give a kind of closing to this, I would say, like, I've had experiences where I've slept for like 8 hours, and when I got to wake up, I still felt tired. I wanted to go back to bed. And then other instances where I slept for like 4 hours, and then I felt very active for the day. The brief idea behind this is the fact that I spend more time in the deeper area of sleep for restorative sleep for 4 hours, 5 hours, rather than 8 hours. And so, based on this, we could define sleep quality as the amount of time spent in the stage of deeper sleep. And from our literature review, we got to see that good sleep quality will have at least 25% of the entire time spent in deeper sleep, because that's like the sleep we actually really need. Where everything just kind of steps you into that process of being asleep, getting your muscles relaxed, having the hormones released, and just getting to rest for sleep. Next slide, please.
And after our literature review, we developed a hypothesis that individuals from socioeconomically deprived areas and with low income tend to have smaller deep sleep ratio. So using all of us data set, we created a cohort of 9,695 adults of age 18 to 70. So we use this specific age range considering the actively working group of people. And we use the area deprivation index data from the dataset to determine the socioeconomic status of people. The value of deprivation index ranges from 0 to 1, where 0 means no deprivation and 1 means complete deprivation. So this index factors in different variables like a person's income, education, employment, housing, and other variables. And after data cleaning, we calculated the deep sleep ratio of a person. So deep sleep ratio is the ratio of total deep sleep time out of total sleep time. And then we perform different calculations. Next slide, please. So here are our preliminary results. On the left, we have a scatter plot for deprivation index versus deep sleep ratio. Here, each blue dot represents an individual, and the position of the blue dot represents the corresponding deprivation index and deep sleep ratio. On the right, we have correlation matrix. So correlation between two variables means the strength of linear relationship between those two variables. And the value of correlation ranges from -1 to +1, where +1 means perfect positive correlation, 0 means no correlation, and -1 means perfect negative correlation. If you look on the red boxes, we have a correlation value of +1, which means perfect correlation. And it is true because it is the correlation between a variable with itself. Next slide, please. And if we look on the blue box, we have a correlation, we have a negative correlation between deprivation index and median income. And the correlation coefficient is -0.81. So this suggests us that the higher the median income of a person is, the less socioeconomically deprived that person is. And this result validates our hypothesis statement. And similarly, if we look on the orange box, we can see that there is a positive correlation between mean activity calories and mean steps. And similarly, if we can see that there is a positive but less statistically significant correlation between the deprivation index and deep sleep ratio. And similarly, there is negative but statistically less significant correlation between deep sleep ratio and income levels.
Next slide. Okay, so from our results, what we begin to see is that there is a bit of validation to the initial hypothesis, but it's not kind of complete. We see a negative correlation between deprivation index and the income levels, but then we get to see a positive correlation between deprivation index and deep sleep ratio. And now it brings the question, are we trying to say in a more deprived area, you have people with better sleep, because it doesn't correlate with the same idea of income levels. And so what we're looking at as a future step is to actually analyze the separate factors contributing to the general deprivation index to see what correlations they will have with the deeper sleep ratios. By these factors, we mean factors like housing, insurance, education, employment, and probably job opportunities in a particular area. Another step we're looking at is to analyze the associations between the deprivation index and sleep outcomes in areas, and to see how this varies across genders and ethnic groups. Next slide, please. In the next slide, you see a bit of some of our the texts that we use for our literature review. And in the next slide, we would like to say thank you for listening. We'll give our sincere acknowledgements to Dr. Chan Lee, who was our advisor for this project, has been our advisor for this project so far. And our sincere acknowledgements to the All of Us Research Program, the Fisk University Department of Life and Physical Sciences, and to the NIH for funding this research. Thank you.
So thank you very much. Outstanding presentation. I was thinking about the implication of this in terms of the fact that these are two undergraduate students. And so we're going to queue that up for some questions. I'm not able to see the Q&A yet, but we're going to actually, I was going to alter the agenda, but I think we need to stick to the agenda, Leah. So I'm going to go ahead and introduce our second speaker, who is Dr. Leah Alexander. She's the director of the MPH program at Meharry Medical College, longtime friend, but also the winner of the CCPH RWJF Health Equity Award as well.
Yes,
and so I want to acknowledge Leah. We're glad to have you today.
Thank
Leah.
you. Hello, everyone. I bring you greetings from Meharry Medical College. It's right across the street. Next slide, please. So we are fortunate to be a part of one of the HBCUs that has been funded to learn and use All of Us data. So I want to just share our ideas and our student projects. So next slide, please. So at Meharry, we teach health caring. I feel like local people are here in the room, but there may be folks that are joining that aren't really familiar with Meharry Medical College. Meharry was founded in 1876, and we have this wonderful salt wagon story that we share, where Samuel Meharry got stuck in the mud with his salt wagon and was assisted by a previously enslaved Black family, and he made the promise to come back and do something positive for African Americans. And so that was like the philanthropic gift that led to the establishment of Meharry Medical College. And so folks may know that Meharry has a medical school, a dental school, but we also have a new school. It's a School of Applied Computational Science, and we have a School of Global Health, and the School of Graduate Studies, which is where my program sits. Next slide, please. So just to tell you a little bit about our program, we want to train students that are interested in public health. We say that we are public health practice. And so as a part of that, we know that research is an integral part, even for students that do our master's program who want to work in community and design and implement programs in community. They're evaluating those programs, and evaluation is very closely linked to research, which is why this All of Us opportunity is so important to us. Next slide, please. So I won't read this slide to you. These are the goals that we sort of hang our hat on for all of the students that choose to come to Meharry to do a master's in public health. Next slide, please. So this is our All of Us team. It's myself, a colleague, Wansu M, and also Dr. LaMonica Stewart. we are, grateful for this opportunity to join the institutional champions, and we have been responsible for rolling this initiative out on Meharry's campus. So we're excited to be at the table. Next slide, please. So one of the things that we decided to do, and the way that we thought would be most valuable for our program, using All of Us data, is training our second year MPH students to use the data for their capstone. So what you see here is our sort of inaugural group of students who are participating in All of Us this year. So we have 12 students that agreed to sort of go on this ride with us. Next slide. So in order to complete your MPH at Meharry, you have to do a capstone project. And we call that an integrative learning experience. And so what those students that you saw in the picture before have agreed to do is use the All of Us data set for their capstone project. And this is a bit of a change for us because in previous years, students found a supervisor, they may have done something community-based, they may have done a secondary data analysis with local data from a faculty person. But because of the resources that were provided to us, we were able to recruit this cohort of students and say, okay, we're going to learn new skills here and expose our students to a little different way of thinking about secondary data analysis. Next slide. So our program is CEF accredited, and so that means that we have to build everything on competencies. And competencies are really just skills that we want to ensure our students have by the time they leave Meharry. And so we've worked with the students to outline the competencies that will guide each of the projects. And those competencies, as you can imagine, are around data analysis, understanding what statistical tests that you need to use, and then also thinking about ways to present your data. But the other piece that's really very important to us, and we're rolling into their projects, is thinking about how to share this data beyond scientists, right? I think there's a little bit of a learning curve when we get, talk about some of these analyses, but because we're public health practice and we prioritize community engagement, one of the things that we're asking our students to do is to make sure that the way we disseminate and share our research findings is something that will be sort of acceptable and engaging for community. Next slide. So just to provide some updates, I will say, I think we were overzealous in our plans to get started with this. So at first we had students with individual projects. So that would have been, 12 or 13 individual projects. But after getting into the data and beginning to learn how to access everything, we thought it might make better sense for the students to work in pairs. So right now we have about 6 to 8 projects. And these are some of the topics that the students are focusing on. So we're Meharry, and we focus on health equity and the elimination of health disparities. So all of the projects that are coming out of our team will have that through line in them. But of course, students are focusing on African American populations, Hispanic ethnicity, women of childbearing age, pregnant women. We have a student project looking at obesity, sexually transmitted infections, chronic diseases like diabetes and cancer. And then another thing that is so exciting for us in Meharry, we were recently funded by HRSA to establish a maternal health equity research center. And so we see this opportunity with all of us to align with some of our goals and expectations for our equity research center. So we have several student projects that are looking at infant mortality, maternal mortality, and pregnancy outcomes. So we're so excited to be at the table. We're so grateful. I can't say enough about the RTI staff and folks who have supported us along this journey. And we're looking forward to maybe another opportunity to hear from some Meharry students next time. Thank you very much. Have a great day.
So thank you, Dr. Alexander. I need to speak louder. Okay. Okay. All right. So we're getting some comments that I'm not talking loud enough. Okay. All right. So what I want to do now is entertain questions. And I'd like to start by actually having our two students. Why don't you take this mic and just turn it around? Well, that mic, is that mic fed into this one or this one only? So come over, yeah, use this one instead. Yeah. I'll just stand beside me. Yeah. So what I'd like for you to do is, so first of all, I want to say outstanding presentations, right? And I was really impressed with the quality of the analysis and your commitment to the work. What I'd like for you to do is to really talk a little bit about you. Just briefly, I want to hear about you in terms of how did you get into research as an undergraduate student? Oftentimes when we think about research, we think about it at the graduate level. But what I heard today was the opportunity to engage students at the undergraduate level in the use of the Researcher Workbench. And so what I'd like for you to describe is, how did you hear about it? How did you access this opportunity? And maybe the difference it's making for you now. I'd love to hear from each of you. Thank you.
Really loud, but don't worry about the mic, it's really loud.
All right, so yes, thank you for this opportunity. Like I said earlier, I'm Meharry, junior at Fisk. So this is my third year coming to Fisk. I'm an international student, and I came with the idea of being interested in basically on the pre-med path, with a plan to go to med school after. And so, but prior to that, I had questions. I was asking myself questions. Would I want to be somebody like, working in a hospital or being more engaged in research, asking questions in order to improve health quality and equity. And so coming to Fisk, I guess the few factors that helped was the environment. My advisor first, Dr. Brian, I'm happy he's here today. And having discussions with him, I was privileged to be a part of his lab in the first semester, my first year at Fisk. And so that was my kind of first-hand exposure to research and research concepts and the importance in our day. And then after being there, being there, the experience kind of gave me the feeling of this is something I would love to do moving forward. And so it was along the line that I got to meet Dr. Lee, that's my biostats teacher, who was also our advisor for this project. And it was the one that kind of linked me up with the opportunity with the All of Us research. And then after some conversations with him, and then I also spoke to my advisor, Dr. Nelms. He encouraged me to go on with it. And I think he also recommended me for the program. And so that was how I kind of got introduced to the All of Us research program. Now, so far using the database, it has been a very interesting journey. Like I said earlier, I'm a double major of biochemistry and data science. So the All of Us research database using Python programming language, as well as comparing it with like research questions for healthcare and equity, has been like a kind of a very good intersection comparing my majors, biochemistry and data science. And it has just kind of opened me into this whole world of computational science, looking at correlations, patterns, statistics, and I would say it has been an awesome journey so far. Thank you.
So, hello all. And as said, I'm Researcher Nepal, and I'm a double major with physics and computer science, and I'm a junior. So, like, my interest in research comes way back when I was applying to colleges. So when I was choosing college for my undergraduate degree, there were some seniors from my country, Nepal, who were studying in Fisk University. And I used to discuss with them about like about the university and what possible research opportunities there are available. And several of my seniors said that like Fisk is a good place to be for, like if you have a research interest. And then yeah, I took their advice. I came to Fisk University, and I was physics major for my first and second semesters, and I was working with Dr. Branke Wallace, who is the Dean of Natural Science. And I worked with him setting up other robots. And then I came to realize that, okay, I think working with him, I have realized that I want to work with like physics or computer science researches. And then I was approached by Dr. Ching Lee, who is not available here now. So he recommended me for all of us research program. And yeah, after I used to like earlier view data as just data, and after like getting into this research program, I realized that there are many impactful things that you can do using those data. For example, like using those.
So I have a follow-up question, so come back up. Yeah, so you mentioned Python. So we've talked a little bit about the use of the Researcher Workbench, but in particular Python. So could you say a little bit more about what the experience is like once you enter into the data set, and in particular the use of the Python language? So kind of unpack that for us, okay? All right, thank you.
All right, so when you get access to the data set, I think before you get to interact with any programming language or technical computer language, the way I'll call it the UI, the way the UI is structured, that's the user interface. The way it's structured is that there are buttons that you just use to click and stratify data. So by this I mean like you can stratify data based on age, based on different factors, so many factors, and some of the factors include like surveys that people might have taken. I think a common survey question was like asking like what drugs do you typically use or something like that. And so if you're trying to investigate something related to drug use, you're looking at like, okay, questions like that. And these surveys have been collected, I think that they've been collected like over decades. And so the database has all of this data. And so based on these surveys, based on these characteristics such as like age, you can also use income levels, like so for like annual income, if you're looking at trying to investigate people that are earning anything between 120K to 160K, you can actually specify those particular figures, and then it's going to give you a sample size. Also going to give you factors about like, okay, so if I think the data set has about 450,000 individuals, and then by the time you put in all these like factors and variables, let's say we're looking at an age group of 25 to 40. So now everything gets to begin to reduce, and then based off these questions, you get to have like a data set. Probably like at the end of the day, you have like 500 people to study, and then it's from after stratifying these cohorts based on like the good user interface, the UI, like I said. After doing all of this, that's when you now get to transition all of this data into a Jupyter notebook and get to use the Python programming language. The good thing about using the technical language is that it helps you to have a very high throughput, so you don't have to get to look at each individual. It's easy to use. Basically, you can use stratification and other factors, and you can just set boundaries as to what you're looking for. It helps you to kind of stratify the variables. So if you have like 500 individuals, you're having every single variable that has been collected on these individuals, and that's a very large amount of data. And so that's where the Python programming language comes in. You can just specify what you're looking out for. For example, in our research, what we specified was just to look for Fitbit data based off sleep. And so we could see the time spent for sleep, and then the time spent in these certain sleep cycles for these individuals. And then we could also look at their deprivation indexes and also other accompanying socioeconomic factors like their income levels, and then they make correlations based on that. So I think the big overview is there's a simple UI that you can use the database and interact with it. And then after that, you get a bit more technical and you use Python programming language for high throughput.
So we have a question before you.
So much for your amazing presentation.
Why don't you use this mic?
Thank you so much for your talk. So I want you to share your experience on using all of us research data set that cohort you use as compared to your prior experience working with census.gov or iPads data or other UC Urban data set. Can you share your experience with our students? How working with this data set was different, better? What were the challenges? What were the advantages? Compare using this data set with Google Dashboard, UC Irvine, and iPads and other data sets.
I think it will go first.
Sure. So I have earlier experience of working with data from Kaggle, and there I realized that the data were really specific to the data were like really specific, and in all of us data set there was a broad data, and for any like research idea that I have, there is some sort of data that in the all of us data set, and also yeah, we could narrow down from the large broad of data set to a narrow specific data set. For example, we started with I think 9 million data, and we ended up in 9,000 data. So there was a way for us to narrow down our research to a specific research question, which I think it was not possible in Kaggle dataset given the size of the data. So that was my experience.
Yes, another thing I would like to add was in relation to like iPads data and all of us research. I think a main difference is the iPads website doesn't have an inbuilt Python notebook or Jupyter notebook you can use alongside. And I know like with iPads you have to kind of download the data and then do whatever you want to work with it on your own. While I know the all of us research, you get the data, but then they also have resources to help you with the Python notebook on the database. And the good thing behind this is because I know all of us research allocates like memory. So for example, and this is just more of like computer. Sometimes if you're using like if your RAM size is a bit low, when you're trying to work on like coding data sets and all of that, everything gets to kind of gets chunked up and gets slow. And that's what happens when you kind of download the data. But for the all of us research, it's not particularly using computer memory. It has allocated disk memory on the website. And so it kind of makes the experience, I think it kind of levels the playing field. So if he is using a 16 gig RAM computer and I'm using a 4 gig RAM, we're still going to have the same experience using the same programming languages because we are working on the data set online rather than having to download it and use it manually.
And something I'd like to add up on this is there are Python is almost like plain English. It is easier to use, easier to write code in, and there are multiple libraries, built-in libraries in Python that we can use. We used pandas for data analysis, and for data visualization we had Matplotlib library. So given the presence of multiple libraries in Python, it was really easier and more convenient to work in this research.
Let's give them a hand. So as I listened to it, I thought that the implications of this are really significant in terms of understanding sleep deprivation and sleep patterns. When we think about individuals who live in communities where there are a lot of environmental factors, there's noise, there's a lot going on, there are toxins, all of that. So to think about how we could take the baseline data that's been collected and then just overlay that with additional variables, so it's really exciting. I think that's what the promise of all of us really is about, is really understanding the implications of health and environmental factors and other elements on people, on population health. and we're able to stratify that and really drill down. It's my pleasure now I want to just say thank you to our students and thank you to Dr. Alexander. We'll have a time for those of you who are joining us online to actually ask additional questions as well. I want to now introduce Dr. Kareem Watson, who is the Chief Engagement Officer of the National Institutes of Health All of Us Researcher Workbench. Kareem leads the All of Us Researcher Program's efforts to foster relationships with participants, communities, researchers, and providers across the U.S. to help build one of the largest, most diverse health databases of its kind to study health and illness. And Dr. Watson and I talk often about the potential and the hope of all of us. Prior to joining NIH, Kareem spent over 15 years as a community engaged research scientist with research funding from the National Institutes of Health, addressing cancer prevention and control. He also held administrative roles in leading research and engagement in federally qualified health centers in the Chicagoland area. Join me in welcoming Dr. Kareem Watson.
Thank you so much, Mr. Richmond. Thank you, Al, for this opportunity. And I won't be up before you all long today. Just wanted to come in and say thank you and to say what an honor and privilege it was for me to join the last part of that discussion. And I want to echo what Mr. Richmond said. The importance of the work that you all are doing as students will hopefully lead to work that you will do in postdocs and other graduate programs. And when you think about, I like to think about the promise that the All of Us data set offers. As a health disparities researcher, as Mr. Richmond said, I spent over 15 years at the University of Illinois at Chicago studying cancer disparities. Understanding that in our community in the Chicagoland area, for example, life expectancy changed by 20 years by taking one train ride. From going from one zip code to the next, life expectancy changed from 85 years of age to 65 years of age. And as that life expectancy changed, you can imagine the demographics of who was living longer in that community at 85 was more affluent, non-minoritized populations versus the population that had a life expectancy of 65 years was a community on the south side of Chicago, more working class, lower SCS. And that's not a judgment or stigma, that's just a reality or fact. And we know all the factors that go into why that community has that lower life expectancy, that lower age. And when you think about what that does for a community, when you cut someone's life short by 20 years, that's 20 years less of economic impact. That's 20 years less of interacting with that family member. That's 20 years less of knowledge from that elder or that senior. That's 20 years left of intergenerational connection that can take place. And the list goes on and on. So I'm so excited for the students and the faculty and the researchers at Meharry and Fisk in doing this work because it's so important. Second, I want to just talk about the importance of taking this to the next step. I'm so excited that you all are utilizing our Researcher Workbench to advance your research questions, but I want to remind you of the power within this data set that is at your fingertips. We now have researchers applying for career development awards, K awards, using our research data set, our research workbench to apply for our grants, research R01s, R03s, R21s, understanding how to utilize our data set as a secondary data analysis, a tool that can be used to compare our populations to other populations. We are now one of the world's largest secondary data sets for sexual and gender minority data, right? Think about the social determinants of health questions that we ask, over 26 measures, looking at things like spirituality, the role of religion, the role that discrimination plays in the healthcare system, how I'm perceived by my healthcare provider. Imagine coupling that data with data on ancestry, with data from the electronic health record to look at patterns of care, patterns of compliance and adherence to certain screening. Last, I want to close by encouraging you to utilize the office hours, but also to remind you that we are here as a resource to you. And if we are not providing the appropriate amount of support and resources for you to do this work, please let us know how we can be better, how we can do better, because your success as researchers in doing this work and advancing this work and utilizing the workbench is what this is all about. Without you getting in the workbench and doing the work to ask those questions around health disparities, our research will not live up to its full potential.
I have a question for you in terms of, what are your hopes in terms of the Researcher Workbench? You talked some about where we are today, I'd like to hear more from you as it relates to the future of the researcher.
All right, it looks like I have the thumbs up to go, and I want to answer Mr. Richmond's question. What is my hope for the Researcher Workbench for the way students and faculty will utilize it? One, as I was beginning to say, Ms. Richmond, I'm hoping that students and faculty will utilize it to answer questions that they have not been able to answer before because of the diversity of our data set. For example, I was recently talking to a lung cancer researcher who also looks at tobacco cessation. We have tobacco information on African Americans that you don't find in other data sets, right? So how can we help researchers use that to understand the challenge of tobacco use in underserved and minoritized communities to address those health disparities? Even future research projects on using AI and machine learning. While I'm so excited about the promise of AI and machine learning, I'm also mindful that data out and algorithms created from AI is only as good as data in. And that data in is only as good as the people putting it in. And if you don't have, my concern is that too many of the people that we have writing these algorithms in this programming language don't have the lived experience and the deep understanding of the intersectionality that can exist when they're writing these codes. So I'm also hopeful that programs at our HBCUs and other will really think about how to use AI tools, machine learning tools, coding better to really understand some of these algorithms that can predict modeling of disease. Look, I wanted us to be able to use our data set to think about what populations are at elevated risk, and then think about how that can inform screening interventions based on age, family history, risk factors, and ancestry. And so those are some types of questions, but I can't stress the importance of using it to publish papers, using it to write grants. And if you want to know more about how to do that, I'm totally willing to have part 2 of this workshop. Thank you. I hope that answered your question now.
Thank you. So our next speaker is Dr. Celestial Jones Paris. She is an NIH data at the NIH Data and Research Center. Now, as we will hear from Dr. Jones Paris, who is a clinical scientist at Vanderbilt University Medical Center and a member of the Research Data and Research Center. We're glad to have you join us today in person. Thank you.
Thank you so much for having me. First slide, please. Great. So first, I want to say welcome and thank you for inviting me to give this talk. For those of you that are online, I encourage you to ask questions along the way. I have some of my colleagues from the DRC that are online and be able to drop some information in the chat for you as you ask your questions. And they'll also be here to help me as well. Next slide. So here's what I hope to achieve today during this talk. I want us to be able to learn about the All of Us research program and the data that we offer, explore the public-facing research hub and the tools that are built into that, examine the steps that you need to take to be able to register and use the data. And then finally, I want you to see how you can start a project on the workbench. Next slide. And really give acknowledgement and gratitude towards our participants. Their generous time and contributions are what make this effort possible. Without them, none of these research discoveries or efforts would be able to be achieved. Okay, thank you. So I'll try to also raise my voice a little bit here. We are trying to get 1 million participants in the All of Us data set, and we're actually about halfway there. One of the great things about this data set is that it is rich in diversity, and we strive to try to make sure most of the data set are from underrepresented individuals in biomedical research, what we call UBR. These include individuals from different age groups, different racial and ethnic backgrounds, and different gender minorities. Next slide. Here you can see the various types of data that we have. So not only are the individuals within the data set very diverse, the types of data that we have are also diverse. So we have things like survey responses, physical measurements, genotyping arrays, electronic medical records, whole genome sequencing, and Fitbit records, which include those sleep data that you heard about earlier. Next slide, please. These data can be used in a multitude of ways. This includes different advocacy. So we have a researcher here that is studying maternal health, uterine fibroids, and trying to understand how these data impact the community, and furthermore, make sure that it is stress the reasons why we need funding in research in this particular field. There's also community engaged research where a lot of different underrepresented communities come together to make sure they are represented very thoroughly throughout this data set. And then we also, as you've heard before, have a wide range of types of research that can be achieved by academia. So different faculty can pair up and have very robust research, and they can even pull in support from undergrads to be able to do research, as we've seen before. And this can go all the way back to high school education and engagement. Some of these things can also be done in graduate school, which in the community campus-wide effort here was using pharmacology students that helped with that research. Next slide. So let's take a moment to talk about how the data come into the resource and how people can get access. I won't go into a lot of detail here, but I will just mention that we have a lot of consortium partners across the country that help gather the data from our participants. And once those data are into the resource, we at the DRC help to protect and store and curate those data and help to harmonize them. Our databases are highly secure. We even have individuals that try to hack into our system so we can learn how to secure it even better. Once those things are in the database and secure inside of the DRC where we manage it, we are able to get that into the research hub where anybody can access it on our public database. But then we also have deeper levels of access that I'll go into that require registration, and that is where a lot of the research occurs. Next slide. So here are the 3 tiers of access. The public tier, which contains our data snapshots, our data browser, survey explorer, and projects research projects directory. The data here are aggregate and rounded up to 20 or more, and anyone can access these. It's available on any standard browser, and a matter of fact, we encourage our participants to access this so that they can see how the data are being used and curated together. When researchers want to take a deeper dive into the research, they are able to register into the register tier. Some of the data here are a little skewed for privacy reasons, so the dates are date shifted, but a lot of the information is still intact and able to be used just like any other study. And then if you want to go even further, some of the studies require additional training on top of the register tier because of privacy reasons. So some sensitive information around lifestyle surveys or some genomic information will require a little bit more additional training, but that will get you into the control tier. Next slide. So let's take a moment and look at the Research Hub. Next. While I can't go into all of the details of the Research Hub, I encourage everyone to log on to this particular website. If you're online, feel free to open up another window and navigate it with me. If you're here in person, you can actually join this via your cell phone. It is mobile friendly. So I'll give you a minute to type that into your browser. All right, next slide, please. So as I mentioned before, there's a couple of different levels that we have access for the data. Right now, we're going to what we call the public website, or researchallofus.org. Once you're registering, you're able to go into a deeper level that is the workbench. We'll go into that a little bit later. Next slide. So first, I want us to take a look at the Data and Tools section tab on the Research Hub. And once you go there, you can click on Data Browser. And that will take you into this particular view. And this is a great tool. It's one of my favorite tools because it gives you a high level count of all the information that we have available right now. You can see the different level or the different types of information. And this is where you can kind of get an idea if your research is even feasible for using the All of Us data set. So the way that you use it is in that search bar, you can type in a word of interest, that you're a particular disease of interest, a particular lifestyle, or some type of effect that you want to study. So next slide, what I want to take a deeper dive with here is, let's just test out asthma, for example. So if you type in the word asthma into that search bar, it returns 3 different data sources. 2 of those are EHR domains and 1 survey. You can see how many data concepts are in each. And then further, you can click on each one of those boxes to get more information. Next slide. So let's look at the EHR domains. Whenever I click on that, what pops up is a table at the top that shows the top 10 hits for that search term and how many participants are returned for that. Below that is a list of the keywords or medical concepts that were returned based on that. And you can see the percentage based on, let's say here we had 200,000 individuals that were returned in our search, and the percentage that fell within a particular category of those search terms. You can even take a deeper dive here and click on the keyword or medical concept to get more information. So next slide. If I click on the first one, which was asthma, it opens up a bit more summary information. So I can see how the participants or how the individuals are broken down by sex at birth, age, and sources. Sources being, is this information coming from ICD codes, SNOMED codes, billing information, or surveys and things like that. Next slide. So switching a little bit into a different area of this particular public website is the research directory database. So to get to this, you would need to go to the next tab over and click on the research projects directory. And as you can see, we have almost 10,000 projects in the system. This is huge. The program is fairly young. It's only had data available since 2019. And so you could imagine how many people have been really engaging with this. That's a reflection of a great data set. You can search in this section as well for a keyword of other projects that are ongoing. That way you may be able to get some ideas or even be able to think of some new questions of your own. Next slide. So let's get into how to register to get access here. Next. It's broken down into 4 very simple steps. So first, you have to make sure that your institution has a data use agreement with us. And I'll show you in the next slide how to do that, but first I'll go through the other steps here. You'll also need to create and verify your identity. You can use that, use login.gov or id.me to do that. And then you'll have to do a short training. This training takes about 2 hours or so, but you don't have to do it all at once. You can pace yourself and just make sure that you get it done before you get access. And then last, you will have to sign the user code of conduct. So I encourage those here and online to use this particular link to gain access to this website. That will help you navigate to this and get right into the registration process. Next slide, please. So the first step, as I mentioned, is to make sure that your institution is registered with us. You can do this by going to the About tab on our public website and navigating to the registered institutions. Here you will find a list of institutions, and you can use the search bar to navigate to your particular institution of interest. I can confirm that Fisk and Meharry and Howard are all both in the registered and controlled tier, but feel free to drop those into your search bar just to test it out on your own. A few things that you may want to note is that in the middle column of the table at the bottom, you can see the access level. Not all institutions have access to the controlled tier, but all institutions that have gone through this process have access to the registered tier. If you need access to the controlled tier, then there's also a point of contact for your institution that can help get access if that is needed. There is a request button at the top here if you want to submit a request if your institution is not already listed. Next slide. Okay, so let's dive into how to actually start a project. I'm going to go through this briefly, but it should be fairly straightforward. So we're going from that public website more into the workbench that requires the registered tier. Next slide. So what is the Researcher Workbench? This is the secure cloud platform that you can use to do your research. It's online based, so there's a lot of benefits. It's an area where you have the workbench, but where you actually do the work is called a workspace. The workspace includes the cohort builder, the data set builder, and notebooks where you do your analyses. Next slide. One of the great things about the workspaces is that it's highly collaborative. So many people from across your institution or collaborators from across the nation can join in on your research. We do require that everyone in the workspaces are registered. So that is one thing, but once everyone is accessed, you can add people into your project, and that is how they can help contribute to your research. So if you're not really the best at coding, you can bring in a coder to help do some data analysis for you. Next slide. So we do use a passport model. This means that we approve the researcher rather than the research project. There's a lot of benefits to that, and it helps you kind of get started without having to have a complete idea. So some people like that to be able to explore around, but you will have to do a few steps as you start to set up your project. Next step, or next slide. So this is what it looks like whenever you get into the workspace or the workbench. You can see several blocks at the top. Those are your workspaces. At the bottom, I want to point out there's some very helpful tutorial videos that help people get started, answer a lot of questions. And to add a new workspace, all you have to do is click the little blue X that's right next to the word workspace. Next slide. Once you start a new workspace, a window will open that requires you to answer a few questions and details about what you're planning on studying. This information helps us also feed into that projects directory that keeps us transparent with the public and what's being done. Next slide. Once you have your workspace started, you need to go in and start working with the participant information and building your cohort. So you can imagine there's almost 500,000 individuals in the All of Us data set, but you need to narrow that down to the individuals that you are interested in. So you use the cohort builder to use certain criteria to narrow that down. And that is how you lock in your cohort. Next slide, please. Once you have your cohort, you will need to name that and save it, and then you'll be able to build on top of that concept. Next slide. Okay. And then, so once you have your cohort, you need to know what information from that cohort that you want to study, and that is called the data set. So you use the data set browser to narrow it down. Once you, let's say you're studying asthma and you want to know the demographics of the individuals with asthma, what type of medications they're on, things like that. And that is where you use your data set browser. Next slide. So that's just a brief overview, but I want to share with you a few resources that we have to help you along your way. Next slide. So please email us if you have questions. If you navigate the website, you may see a help button. That is one way you can get in contact with us. You can also use support@researchallofus.org to get in touch with us. And there is a lot of very helpful individuals on the other side of that, where we will try to answer your questions in a very timely manner. Usually it's just within an hour or so that we're able to get information to you. We also have office hours on Tuesdays and Fridays where you can get more information. So we absolutely hope that you're able to register for that. And then we have a user support hub where there's a lot of very helpful information and articles that can usually point you in the right direction if you have certain questions. Next slide. We have a few upcoming opportunities that we want to put on your radar. So there's a convention on April 3rd and 4th that we encourage you to register for. It is virtual and free. This is for people from all career stages. And then we also have the Biomedical Research Faculty Summit that is being hosted by Baylor on May 14th and 8th through 18th. And that is a hands-on workshop that will help people really get a deep dive into using the data, plus a follow-through of several other networking opportunities. And then last, there is a call for papers from the American Journal for Medical Informatics Association, and they have a deadline for submissions on April 6th. Next slide. And with that, feel free to get in touch with us if you have any questions, and that is all that I have.
Does anyone in the room have any questions? Okay, so one of the things I want to acknowledge is that I enrolled in All of Us in November. So this was very helpful. So how many of you have actually enrolled in All of Us? 2, 3, we need to get more people in the All of Us database. I think back to Dr. Watson's point is that we need more diversity in the database. I hope that you will leave today thinking about why it's important. I was talking to one of my colleagues at Fisk, and she was talking about, we were talking about triple negative breast cancer yesterday. And there was an article this morning about triple negative breast cancer in Medscape. And it made me think about the All of Us researcher database in terms of understanding why it's so aggressive, but understanding what are those factors that may be influencing that as well. I want to thank you for coming today. We are actually going to call up Dr. Hussein to share with us. You have a question? Please do not. Okay, all right. So, yes, please go ahead.
I have a general question. If students of Fisk, they join it, register, will they get any credits for their usage, or is it part of that funding, or anyone can join it and get the credits?
I'm actually not sure of that. So, yeah.
So the question is about use credits, is that correct? So everyone that sets up an account will get 300 free credits to get started. And that is included for anyone. So yeah, it's not institution specific.
Thank you so much.
Yeah.
Students should know.
Good question.
So let's wait there. Can you comment on the controlled access levels and permissions that students might be in addition to, the registered tier?
Sure. So the question is about the controlled access level compared to the registered tier. So the registered tier has a wealth of information. You can do a full-on project with the registered tier. There's some information that is date shifted, or there's a lot of information that's date shifted, but the temporality of the data is still intact. So research is fine to still be done there. But there are levels of protection and information that is removed So certain groups that may be very underrepresented are aggregated together. And then there's other pieces of information that may not be there. So if that's essential for your research, you would have to do a little bit more training, and you could get access to the control tier. So the control tier includes the genomic data, and that also includes some more sensitive information about lifestyle. And there's actually a table on the support hub that breaks down which data are accessed in both levels. Good questions.
Thank you. So, Dr. Sain, I'd love for you to come back up. Dr. Alexander, please come back up. And as we wrap up today's convening, I'd like to hear from each of you in terms of your hope for the All of Us Researcher Workbench project, and as institutional champions, what are you most hopeful for in terms of what we heard today was this amazing presentation from 2 Fisk students. And so if you're not familiar with Nashville, the thing that really makes it very unique is that historically Black colleges and universities are very, very close. They're very, and in fact, we're on the campus of Fisk University, and across the street is Meharry Medical College. So there is a real connection between the two. So as I heard the presentation, I was thinking about students who left Fisk at one point in time and then actually walked across the street and then became doctors and dentists. And what's special about Meharry is that the doctor that attended my mother at my birth 64 years ago was a Meharry graduate, delivered my twin sister and I successfully. And it raises the question for me is, what is it today that's so different that's occurring in our healthcare system that 64 years ago, my mother could deliver what would be today kind of a complicated pregnancy, but we were successfully birthed. What's different today? And I think about the All of Us Researcher Workbench and what we may find out there in terms of birth complications, but that's on a personal note. So I'd like to hear from you about what you're most hopeful for in terms of the Researcher Workbench. Thank you.
Sure, I can go first. I'm really excited about this opportunity we had. I can share the experience. At Fisk, we joined All of Us Research a couple of years back, but unfortunately our workbench was not used. And I was quite concerned at how to make it happen. And I'm so glad that based on Dr. Jing Shali's initiative, we got this funding.